I am Dr.Narayan, consultant physician from Kolkata. I will be briefly discussing about the upcoming heat wave in India and to how protect yourself from the heat wave and heat exhaustion. As we all aware that around 3,000 lives are lost due to heat wave each and every year in India, and the number is increasing each and every year due to global warming. So I'll be discussing briefly about three things. First, you should know who are the most susceptible person who may be affected with this heat related disorder. Number two, how to protect yourself. And number three, what happens if somebody is suffering from heat related disorder. So, heat related disorder occurs mostly at the extreme of the age. If a person is exposed to a hot and humid climate who is more than 65 years, who is a kid, or who is suffering from multiple medical comorbidities, or who are on certain drugs which produces dehydration, they are the person who are mostly suffering from heat related disorders. And what happens if a person is exposed to heat for a prolonged period? Suppose he may be a normal person. So what happens that gradually, if the person is exposed and the body is not able to regulate the temperature, then the person becomes feel nauseating, there is a headache, and there is a bit of confusion and a muscle cramp. That calls the heat exhaustion and heat cramps. That we are all, I think we should know. Somebody who is exposed to heat for a prolonged time and not taking water properly, he or she may become unconscious, and that is called heat stroke. If you touch that person, you feel extremely hot condition of the skin, her skin is flushed, and that is the first differentiating point that the unconscious patient, this unconsciousness is related to heat related disorder. Don't waste time, you just keep that person to a nearby place, where slightly cooler place, just cold sponging, and try to reduce temperature and bring him to the hospital at an urgent basis. But in case of heat exhaustion and heat cramps, you should recognize, in that case you need not to go to hospital. You have to go to a cooler place, take lot of water, and you try to bring down your temperature by taking a bath. You should avoid taking alcohol in this season and caffeine also, because they are all diuretics, increasing your urine volume and producing dehydration. Now, what precaution you should take to avoid this preventable disease to some extent? Our advice is to wear a light shaded dress with loose fitted dress. Try to use umbrella. Don't over exercise during hot and humid climate, and if it is possible to remain inside your room, especially for the patient who are more susceptible, like the younger one or the extreme age, they should not go outside unless it is absolutely necessary. So friends, take lot of water, avoid alcohol, avoid excessive caffeine, try to avoid exposure to hot and humid climate as far as practicable, wear a light shaded dress and the garments which loosely fitting. I think you can avoid this calamity. Thank you.